quite fine, and I'm going to record this conversation because of where I'm at.
No problem.
And then my dad's over here on this side.
Hi, Dr. Chang.
Hi, Mr. Craig. It's Dr. Chang here. I'm on the call with Jen Smith, too.
Oh, hi, Jen.
Hi, Jen.
Hi there. Hi, guys.
Oh my gosh. I'm very, very grateful for you guys because of what you've done, and just everything is so cool.
Thank you, Michael. Give me more information. How are you doing with the seizures?
So no seizures, 122 days since the surgery.
Wow.
And I sleep like 8 o'clock till 6 in the morning. I get up maybe 2 or 3 times a pee, but it's very, very rock solid, and I dream. It's a life that I've only dreamt of to be living.
How about the words? I know that we had a lot of difficulty with
Yes.
word finding.
So
with language. Has that gotten better?
It's gotten a lot better. My speech pathologist, Scott, has said that I am what is it called? I'm one of his prize students too.
Amazing.
Yeah. And it's a little hard because of the word finding, that kind of stuff. But I'm about 80% along the way to my normal bar.
Yeah, you sound fantastic.
Yeah.
Your bar was a bit higher than most people because you're so, look talkative and whatnot.
Yeah, and intellectual, right?
Yes, yeah. That's fantastic. How's it healing up here? Oh, that looks great, man.
Yeah.
Really, really good. Oh my gosh.
Yeah, so
Fantastic.
I go to the gym every day. I meditate. I do yoga. I practice gratitude, and I'm just very, very, very grateful for everything you've done.
Great. Well, we're happy to be a part of your team, Michael.
Well, thank you.
Yeah.
So.
Well, today was just a check-in because I knew that you were still having quite a bit of the word finding before, so I wanted to just keep following you to make sure that it was getting better. I was very confident it would, but we don't really want to sign off until we know. So, it looks like you're healing up beautifully. Yeah.
I appreciate that. That's really good.
You might have a little more gray hair than I remember, though.
Oh yeah, it's definitely there. But yeah. Yeah, but that's okay. It looks good. It actually looks good. So, am I cleared to swing the golf club and do some weights?
Yeah, go for it.
Oh,
looks
nice.
Yeah.
Awesome. And I'm cleared to drive too, but I have been driving, so thank you for that.
Yeah.
What is so I'm just leading into what was the tumor name and the surgery name and that kind of stuff?
Yeah. Let me pull that up right now.
Okay.
Jen, do you have that there? It wasn't a tumor.
No, It was consistent with focal cortical dysplasia, yeah.
Okay.
ILEA 2A.
Yeah.
Spell that.
We'll put that in our after visit summary, but long story short is that it's not a tumor, it's not cancer. What it is kind of like a birthmark on the brain.
Oh, wow.
And a scar, basically, that the way that the neurons were developing in that area just turned out in that one area was causing seizures. And so we see that quite a bit, Michael, where people can have that kind of change. And you've probably had it since you were a baby, to be honest with you.
Since birth.
Yeah, that's usually when these things start. Now, when it presents with seizures, sometimes it doesn't show up until someone's older. But there's always some abnormal electrical activity that you're not aware of. And then, sometimes it becomes more apparent when you're a kid. Other times it's when you're an adult. But at the bottom line is that these kind of things are probably been there your whole life. And it's a small part. That's the only place that we saw that abnormality. So I'm glad that we got that out of there.
Well,
Yeah.
thank you.
Yeah. So what we did was called a craniotomy.
Okay, got it.
And it was up here, as you know, in the left frontal area.
Okay.
And that is an area that is involved with language.
It was very, very affected in the beginning.
Yeah. Well, what's interesting about that, Michael, is that this is not one of the language areas that we learn about in medical school, but it's one that we kind of discovered actually only over the last 10 years. Is really important for connecting words and their meanings, because you clearly knew what you wanted to say, but you just couldn't connect it with the right word to put in your mouth. And I think over the last couple of months, your brain's been able to reconnect, the words and meanings. So, kudos to you, the hard work, and your language pathologist, your person that you work with.
Yep.
That's really all you to get that back.
He is very fantastic, by the way.
Really?
Yeah.
Yeah. Maybe what's his name? Because we need to know, and we keep track of it because there's a lot of patients that could be benefiting from that.
Yes.
So
yes. Yeah. His name is Scott Davis.
Scott Davis.
Yeah.
Okay. Where is he? In Hawaii or?
No, he's in Michigan.
Okay.
But he's 60.
Oh, you did it remote?
Yeah, telehealth. Yeah.
That's amazing. Okay.
Yeah. And we did it twice a week since the 17th of September.
Okay.
Yeah.
That's great. Well, we might give him some more business then, because we do need help with people that can do this.
Yeah, I appreciate that. Or he appreciates that.
Yeah. Scott Davis. Okay.
Yeah. So, did you rearrange anything in there?
Not really. I mean, we just took the stuff out, and it's going to fill up with just fluid. Our brain and spinal cord, it's bathed by cerebral spinal fluid, CSF, and that helps clear the metabolism and other things out of there. It's very healthy. But bottom line is that area that we remove is just going to fill with fluid. And that's normal, and that's healthy, and that's good.
Okay. All right. Because I'm starting to experience some really crazy things in terms of my listening and my eyes, and they're very acute.
Really? Like what?
So I had good ears before, but now I hear conversations that are like two walls, closed doors, walls, conversations that I can repeat. Like my dad. So.
Oh, really?
Yeah.
Wow.
And then my eyes have improved, and my mind has improved. I mean, it's just crazy.
Oh, are you still taking the same level of the medications?
Yes.
Okay. Well, you're gonna have to continue that for a while, but I think things will even continue to get better even once the medications come down a little bit. There's no hurry, and
No.
I suggest you continue to take them for now.
And I have been. So
Okay, good.
But I've missed a dose and I didn't feel anything, so I was just like, all right, well, I'll make it up the next day, in the morning.
Yeah. All right. What other questions do you guys have?
I have a brother that had surgery the same day as me. So, and I didn't catch his name. Do you have any HIPAA violations to disclosing his name?
Oh, yeah, definitely. We cannot disclose.
Does it rhyme with anything good?
Well, I don't remember. I have to go back and look at it, right? Yeah, I don't even remember right now.
Yeah, because I have been dreaming about him, and he said hi to me in the hallway, and I was just so, my language was so messed up that I was just like...
What was the day of your surgery again?
August 12th, and he was an Asian kid that looked a lot like my little brother, and he was from Reno, Nevada, where
Yeah.
I'm technically lived.
Yeah, yeah, you're right. There was a kid of that demographic. Yeah, yeah.
Okay.
He's doing good though.
He is doing good.
He's
Okay.
doing.
Could
Yeah.
you could I give you my information to share with him?
Yeah. Okay. We'll share your stuff with him, and we'll see if.
Okay.
Yeah.
All right. Yeah, because I'm sure that he will want to reach out to me to see how I'm doing.
Okay.
Okay. And our next follow-up appointment is when?
Well, you're technically done with me, just so you know.
Okay.
Yeah, today was even optional, but I just wanted to keep following you and making sure that your words got better. But that's pretty much it. You know, we're done. You're gonna have to continue with your seizure doctor.
Which is who?
I need to look that up.
Dr.
Like who's?
Dr. Rao?
Yes, Dr. Rao.
Okay. All right.
Yeah, he's gonna want to continue to see you, but you know, primarily just to check in.
And then, as a personal question, how many of these do you do a year at your place, at your hospital?
Well, about just for this kind of thing, Michael, for epilepsy, we do about 100 surgeries, 100
Jeez.
to 150. Yeah.
Wow.
I do other things like brain tumors and pain and other things, but of just epilepsy, which is my focus, it's about 100 to 150. Yeah.
Wow. Okay. And then, how old are you? If you
Oh, I'm 50.
You're 50?
Yeah.
What?
Yeah.
Wow, you look young. Okay. All right.
Oh, I appreciate it. Yeah.
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 Okay. All right. Well, I don't think
I'm a little bit older than you. Yeah.
well, your hair definitely doesn't look it.
Yeah.
I have some questions.
Yeah.
My dad has some questions here.
Okay.
Dr. Chang, and it's can
Hey.
can
Oh, hey, Mr. Craig. Good seeing you.
yeah. Well, thank you.
You're Mr. Soon, right?
Yeah. Yeah.
So, can Jen hear us too?
Yeah.
Okay.
Yeah.
Well, I just want to express my wife's and my gratitude. It's been decades of concern and pain and a lot of worry. And we're just so grateful. If there's anything that we can do to assist you in any way, please let us know. How can we join your team and do what little we can do to help you and help others?
Thank you.
Thanks, Dad. Yeah, I appreciate you, and I appreciate Michael, of course, and we appreciate the trust that you gave us. I know this was not easy. In fact, this is extremely hard. You know, Michael, there was like no easy part of what you did with the implanted electrodes, the awake surgery, the work you had to do to get your words back afterwards. Like there was really no easy part of this. But I do appreciate that you trusted us because, you know, that's what really counts. And we never take that for granted. And we're thrilled, you know, but I do remember how hard it was. And it's like that for other people too. It's not easy for anybody, basically. But you did an incredible job, and you had positive attitude the whole time. I was very, very impressed.
Well, thank
So,
you.
yeah. So, Michael, I think you're a remarkable person overall, and got an amazing family, of course, too. But what you went through was very, very difficult. But I knew you were going to be able to do it, and we got a good result too.
Was there any given moment where you thought that maybe I didn't qualify for the surgery?
Well, the challenge of what we did was that not a lot of places can do this, what you did.
Right.
With implanted electrodes, one thing, another thing, the surgery is one thing, but Dr. Rao and their whole team on the neurology side, they were looking at your signals every day. Every minute of your EEG was being analyzed. There's so many people behind the scenes too, the nurses and the technicians that were watching you 24/7 like a hawk, so that when you had a seizure, we could make sure that you were going to be safe. And then all the smart people, that work with us to analyze the data, you will probably never understand or, know the extent of what's even happening there. So just want to let you know that this is a team effort, and we got your back. And again, we're just, grateful for your trust in us too.
Well, I was trusting, but I was going downhill really fast.
Yeah.
And so,
Yeah.
it wasn't much of a choice when you guys gave me the option to stay awake, or
Yeah. Yeah.
implant the nose and all that stuff. So I just wanted to just commit to you guys, really.
Yeah.
In the nature of it.
Yeah. Yeah. I think, it was tough to try to figure this out. If it was easy, we wouldn't have had to do a lot of that, have you awake or put in the electrodes, all kinds of stuff. But we had to do some detective work to figure this out. So it's kind of like a medical mystery,
Wow.
Understood.
Yeah. And I know it was not fun, but I think it was worth it.
Oh boy.
It was beyond worth it to me. Yeah. I'm feeling like way, way, way better, and my attitude's better. I'm just so grateful.
Yeah. Well, one reason why that might be is that the dysplasia, the thing that was causing the seizures, it messes the way that your brain processes information, and so it's like noise in your brain. So now it's quiet. You can, like you said, you can hear, you can see, you can think again. Whereas when that thing was there, it was just constantly like you were surrounded by some noise inside your brain. And so when we remove it, basically makes it a little bit more quiet for your brain to do what it needs to do.
How big was it that you removed? Would you say? Can you use your fingers?
Well, I think if you looked at the total volume, it was maybe about the volume of a plum.
Oh.
Yeah. It's not a cherry. It's not a grapefruit, but like a plum.
Wow.
Yeah.
Quite large then.
Well, nothing less and nothing more than we needed to in order to get the job done.
Yeah.
If we did a lot more, then Michael would have more problem with language and other problems. If we did too little, then he would still, have a lot of seizures. So,
wow.
No less, no more. And that's why I had to have you awake, so I can know that for sure.
Oh my gosh.
Wow.
Wow, that's remarkable.
So in terms of his future physical activities, should we be concerned at all about any weight, any actions? Even swinging a golf club can be very.
Oh no, he's totally fine. Yeah, I mean, you might be a little rusty, but that's about it.
Wow.
Yeah.
Wow.
Yeah. Okay.
So we're not concerned about swelling. We're not concerned about.
No, at this point we're out of the woods. Yeah, you might have a slice. Have to deal with. You might need to work on the slice or a hook or whatever.
Sounds
No,
like you golf.
yeah.
I used to. It's too frustrating, so I don't play that much anymore. Yeah.
Well, we have been, my son and I have been in the real estate and loan business for collectively about 78 years.
Wow.
And I just want to say to you, if you ever need anything,
Yeah.
we're doing it and it's on us. So if you
Okay.
ever need any assistance, you get a hold of us
Yeah.
and we'll do it. And you too, Jen.
Oh, thank you.
Really appreciate it.
And,
Yeah.
and again, if there's anything that, if you could just tell us, just guide us in a direction where we can be helpful to you, we want to do that immediately.
Mhm.
Well, really, the main thing that helps us is, occasionally we may have you talk to someone who, like, I think for many people, they're pretty scared, Michael, to be honest with you. Like, it's like such a huge deal. In fact, I'm kind of surprised how quickly you jumped in. For many people, they'd rather live with the seizures than have surgery because they're so terrified of the surgery. And you kind of had one of the most complicated surgeries, I have to say. So, maybe every now and then we might have someone that might want to talk to you, about your experience. And, you don't have to sugarcoat it.
No.
But I think people need to understand there's hope.
Wow.
So I'm documenting my journey on social media on a daily because I'm just a living miracle for however this works out, and I just want to remember it.
Yeah, exactly. So, so maybe I'll follow up by email with more specific things. But
I don't have a problem doing it.
yeah, I figured. I think you're a very positive person. You want to help others. Yeah.
Yeah, that's part of my journey is just being grateful.
Wow.
Great.
All
All
right.
right. Well, happy holidays. This is
Yeah.
a wonderful visit before the holidays.
So great to see you doing so well.
Thank you, Jen. Thank you so much for dealing with my mom and my dad. But yeah, so you've been wonderful, and Dr. Chang, you've been wonderful, and the team is wonderful. So 5 stars, 100%. Just I support you guys 100%.
Thanks. It goes back. Yeah.
Yeah. All right. Well, you guys enjoy your holidays.
Yeah.
You as
All right.
well.
Okay.
Take care.
Thank you.
Okay.
God
Bye.
bless you.
Bye, guys.
Bye, guys. Bye.